This is the Aerolase laser. A laser, in my opinion, every doctor should have. 1064 wavelength. What does that mean? That goes deep below the surface. You see nothing on the surface, but what she'll feel is a little bit of warmth because it's in the follicles, it's underneath the skin, it's in the acne inflammation. So what's happening is we're warming up the tissue by going deep here. We're going into these acnes and we're trying to kill it. We're really trying to kill it. Over the pigmentation, it helps lift this pigmentation and tell your cells to act and go into those cells and get rid of the pigment. One of the positive things my women love about this is it also treats hair. So when we do your hair, when we're doing a facial, you're getting your facial hair at the same time. So if you actually look over here, she has a couple hair follicles. Look really close. Those hair follicles are lighting up. You see it? See it? We're getting those hair follicles. See? So some women just have them. It's just what they have. There's nothing you can do. Turn all the way to the right. How does it feel?
Just warm.
Just a little warm?
Yeah.
See, look, again, more hair follicles right here. So this is really nice to do at least monthly when you're doing facial treatments because you can get more out of it. You get skin tightening, pore reduction, decrease in redness. It can help her acne and pigmentation. Our laser guru and esthetician, Rachel, likes to combine this with all her other modalities like hydrofacial and dermaplaning to really make the skin glow. But you can see we're really going deep in the tissue without causing much inflammation here. Sorry, honey, right along the edge you might feel a little bit because that's where the hair follicles are. Now, you don't want to go over the brows because every woman likes their nice brows, but it can make the brows go away if you did. So we're following this in multiple passes. And then what we're going to do is go independently over the acne in a more concentrated wavelength, or a more concentrated focus. Now, what people call this is a microsecond laser, which means it pulses so quickly that you don't even see it affecting the surface. Turn all the way left for me. There you go. But this is it. I mean, overlapping pulses get the skin to warm up. Those that have rosacea, those that have acne, eczema, psoriasis, this is very useful for. And my patients who have melasma love doing this treatment because it really helps get rid of the melasma, but you can also combine it with peels, with other lasers. Any questions there on social? Any questions you guys want to ask? Rachel, anything? Or things people normally ask? There's no downtime. You could go back to work. We really want to work this at least every week for a few weeks when you have bad acne, and then you can go down to a few times a month.
I think also when you do this, you're minimizing the oil production for acne patients so that they actually have a smoother texture in their skin and less breakouts.
Yeah, I agree. Yeah, I agree. There's less breakouts, less oil.
Good for rosacea?
Huh?
Good for rosacea?
Yeah, very good for rosacea. Yeah, very, very good.
What's so nice about this, what I love using it, is that it targets water in the tissue as well as the red pigment in your blood vessels. So that's why it's so good for superficial or diffuse redness.
And it helps tighten the skin because of the diffuse heat that it's just giving to the tissue. All right.
What's the name of the laser?
Name is here, name is here. It's called Aerolase. 1064 microsecond pulse technology. The newest technology in treating sensitive skin types. Great for overall complexion issues, hair removal, pigment, acne, skin tightening, oil reduction. The list goes on and on and on. Thanks guys for following.